The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. I'm Physician Assistant Frank Smith, and on today's show, we're going to be discussing cholesterol. Hyperlipidemia, dyslipidemia, hypertriglyceridemia, LDL-HDL ratio. Those are just some of the words you may have heard regarding your cholesterol, and we've all heard a ton about cholesterol in general. And it can get pretty confusing, but at its core, it's actually pretty straightforward. And today, we're going to break it down in ways that you'll understand your cholesterol readings. If you've ever looked at your cholesterol panel or lipid panel results, either from your clinician's office or one that you've done at home, it usually has 5 pieces of information on it. It has the total cholesterol, your triglycerides, your LDL, your HDL, and your LDL-HDL ratio. Total cholesterol is just like it sounds. It's a calculation that uses your LDL levels, your HDL levels, and to an extent, your triglycerides levels to give you a total reading. Triglycerides are the literal microscopic pieces of fat that flow through the bloodstream after we eat. It's the transport mechanism to get those from the digestion area to storage for later. LDL, which most people know is called the bad cholesterol, I want you to think of that as some of the debris that starts to move through the bloodstream as part of what we eat. It's some of the remnants left behind that can start to kind of gum up the works a little bit. HDL is, for lack of a better term, a scrubber that goes and picks up the debris as it goes. The analogy I came up with patients years ago that seems to really bring it home for them is I want you to imagine your bathroom sink, and inside the pipes you're going to have some hair in there, and you're going to have some goop and oil and fats in the pipes, and over time it could start to clog the pipes up. Meanwhile, you also have drain cleaner available. HDL is the drain cleaner, LDL is the hair in the pipe, and triglycerides are the fats and goo in the pipe. And the LDL-HDL ratio is just like it sounds. LDL, how much hair is there in the pipe? HDL, how big of a bottle of drain cleaner do we have? And that gives you a pretty good insight into the overall health of your cholesterol panel. If you have the normal amount of hair and goo in your pipes, but you have the warehouse club size version of drain cleaner, you're okay. If you have a family of 10 worth of hair and goo in your pipes and you have the little convenience store size bottle of drain cleaner, we have a problem, right? A few things to keep in mind on your cholesterol panel. If you had not been exactly truthful about whether or not you were fasting when you had taken this, it throws off the calculation significantly. Triglycerides, the literal pieces of fat, go up after we eat. And the LDL on your lab, if you'll look carefully, it says calculated LDL. And what it actually does is it truly measures HDL, it truly measures triglycerides, and then it does a calculation to figure what the LDL, the bad cholesterol levels, are. So if you told your clinician that sure, you were fasting, meanwhile you had a medium iced vanilla latte before you went in, the results are going to be skewed. So be sure to be honest when you go in for those labs, or make sure you actually go in fasting, okay? As far as what you can do about your levels, let's see if this sounds familiar to you. Diet and exercise. Sorry, it's the truth. HDL, the good cholesterol, nothing impacts the levels of that like exercise. The studies are very clear cut. We do have a few medications that help raise it some. And there are some studies that show some small amount of alcohol usage routinely can raise it some. But nothing raises HDL levels like exercise. And frankly, nothing suppresses HDL levels like smoking. So this is one of those that we always talk about. Stop smoking and get out there and move your hiney. It matters. It has a direct impact on your HDL. LDL is very much diet controlled. What we take in has a direct impact on our LDL levels, our bad cholesterol levels. A nice easy rule of thumb as far as what you should be eating: raw fruits and raw vegetables are your friend. Fats, as much as you can avoid it, are not. Now you'll hear people talk about good fats, bad fats, polyunsaturated, monounsaturated, and all of that can be important once you get the basics out of the way. But on the front end, just start with eat more vegetables, eat more fruit, and if they're raw, so much the better. Less fried foods. Move your hiney and quit smoking. Your cholesterol levels will get better. One that I do want to mention while I'm thinking about it: if just your triglyceride levels are high, what we call isolated triglyceridemia, and all the rest of your labs look fine, if you did a home test with that, be sure to go see your clinician. Isolated hypertriglyceridemia, just where just the triglycerides are high, can be an indicator of some underlying health problems like hypothyroidism. Speaking of which, that is something I'll be covering in an upcoming episode. So that's going to do it for this week's show. The basic gist of what we talked about today, I want you to think of when you look at your cholesterol report. It's how much drain cleaner do I have, how much hair is in the sink, how much fat is in the sink, and what exactly am I going to do about that? If you've enjoyed the show and you feel like you've learned something, please click the like and subscribe button down below. I'll be back next week. Until then, get better and make me look good. Have a good week.